Welcome viewers. Lybrate is doing great service to the mankind. It is serving to the doctors who are practicing in their various specialties as well as helping patients to reach to the best doctors. I congratulate Lybrate for doing this great job, which is the need of the hour. Today I would like to discuss about one of the biggest killer of the mankind, that's the heart disease. I tell people that heart is such an organ in the body which never goes on leave. In 1 minute, it beats 72 times on an average. And since the time of inception in the womb of the mother, when a fetus is 4 months old roughly, it starts beating, and then till the time we take the last breath, it keeps beating. So this is such an important organ. This qualifies for beautiful qualities which nature has given to the heart. First is its muscle, which never gets tired. Like our skeletal muscle, we go to gym, we get tired. Heart never gets tired. Rather, heart over exercises itself for doing better service next day. Second thing is its peculiar circulation. When the whole heart pumps the blood to the body, it doesn't get blood for itself. It only gets the blood for itself when it relaxes, and that is called coronary flow or heart's intrinsic flow. So this is again peculiar. When the whole body gets blood, heart squeezes and doesn't get blood. Third is heart is also governed by various influences like nerves, sympathetic nerves, parasympathetic nerves, hormones like adrenaline. We commonly say your adrenaline is secreting, your heartbeat is faster, you are running and you are in the flight mood or fast mood, or in a mood which is hyperactive. Heart is also controlled by various endocrine glands. Most of the time when we see as a cardiologist patients, we forget to work on these lines. That is why I am talking. It is under influence of sleep, day and night cycle, endocrines. Most importantly, it is under the influence of thyroid. Those who have high thyroid hormone, their heart beats like 140 per minute, double the rate of normal. Those who have hypothyroid, their heart beats slow, like 60, 55. Similarly, heart is also controlled by influences as regards to the blood pressure by adrenal gland and also by a gland nearby. So heart is governed by several influences in the body. And now coming to the point why I am talking all this, that we insult our heart in many ways. We create the biggest disaster for the heart, first of all by not doing adequate exercise. This is most important. I will define this is most important because this is one of the preventable side of this story of the heart attacks and other heart diseases. Number two, we insult the heart by feeding ourselves by high cholesterol diet, by not controlling our uric acid, and most importantly, by not controlling our blood pressure. And many times in the best developed countries of the world, 50% population doesn't know they are suffering from hypertension. Out of that 50%, they go to the doctor and get treated. Out of that, roughly 50% who get treated, they maintain their normal blood pressure. So this is a very intricate story. Today, everybody talks of coronary artery disease, heart attacks, and things like that. Every nook and corner, every district, every city, you have a cath lab, you have angiographies done. But very rarely doctors talk about high blood pressure. They try to not to be very, very intelligently observant on the blood pressure, or they sometimes other specialties doctors ignore taking blood pressure, like an orthopedic surgeon never takes blood pressure. Eye surgeons, they send the patients to some other doctor for blood pressure. ENT doctors hardly take blood pressure. So this is a tragedy of the blood pressure. I will cover my talk on this also in the later part. But first, let me come to the heart disease, heart attack, which we commonly call. Before talking about the coronary artery disease, I will briefly talk about the heart has valve also. And there are 4 valves in the heart: mitral, aortic, pulmonary, and tricuspid. Most commonly, mitral valve gets affected, or second common is aortic valve. So these valves open and close with every beat of the heart. They get wear and tear, they get infected by bacteria, by fungus, very commonly known disease called rheumatic heart disease, which involves the joint, and later on it bites the heart. So in older days it used to be syphilis, very common enemy of the heart valve, like aortic valve. Now we have congenital diseases in which by birth the valves are either deformed or they get infected due to the rheumatic fever and some other infections. Like in drug addicts, they get infected by the fungus, or very deadly bacteria like staphylococcus. Because heart valves are very sensitive and moving structures, they work under pressure. They have the strain of the circulating blood flow with the pressure equal to the blood pressure, and that's why they are vulnerable. So heart valves can be affected broadly for a common person 2 ways: either they get stenosed or they get dilated. If they get stenosed, like left side valve get stenosed, the aortic valve pumps less blood, there is a gradient, one can have complications. Mitral valve stenosis, it puts load to the lungs, so it affects the whole system like kidney, heart and lungs. They work in unison. Most of the cases of these valve diseases are also preventable if they are detected in the early life. So valve diseases now can be treated very advanced way also. Previously we never heard, when I was a student, we never talked about the operation of the aortic valve in a 90-year-old man or 96-year-old man. Now we can replace these valves by transvasal technique, which is called TAVI, transaortic valve implantation. We just put an additional valve which is foldable, malleable, and we come out and the valve is replaced. Additional valve works for the disease valve. So these techniques are evolved over the period of decades, and they are the part of recent advancements in the treatment of the heart valve disease. Secondly, once the valve gets infected, we have to give for a long time antibiotics to keep the valve health good. Pregnancy is another condition in which either valve gets involved or because whole heart gets dilated, or many ladies for the first time come to know that they have a mitral stenosis, very common condition detected during pregnancy. So valves can also rupture during the heart attack. The valves can get perforated, fenestrated. They can get the muscles which contract these valves, which are called papillary muscle, they can rupture and leading to severe valve dysfunction, which is very common feature of the mitral valve. Here also I will mention a word about the septum. There is a septum of the heart which keeps the pure blood and impure blood separate, and many people have got this heart attack. When they have heart attack, then the septum also gets ruptured, and which is very, very hazardous and serious condition. This happens very rarely, 1 in 1 lakh. So this is briefly about the other structures of the heart. Similarly, I will mention briefly about the membrane which covers the heart, and that is called pericardium. So it's a wrapper for the heart. It gets involved very commonly in India because of infection, which is common infection, tubercular infection. So tuberculosis can involve the heart, outside of the heart most commonly. So once pericardium it gets involved, it gets healed by fibrosis. Sometimes this membrane gets as hard as a stone. It shrinks, doesn't give space for the heart to beat and pump the blood. So it is called constriction, constrictive pericarditis. Many conditions affect the heart membrane. So briefly, this is about valves of the heart, membrane of the heart, and other conditions. Then the main pipe, which is called aorta, and the other vessels, they can also get diseased. The aorta basically, and the veins, varicose veins, it's not the topic of the day, but aorta, yes, aorta can get diseased by birth, by the genetic disorders in which aorta can get dilated, The very common condition in which aorta gets involved is Marfan syndrome, in which we have very tall people. The patients are very tall and the aorta gets diseased. It's a Marfan syndrome in which there's aortic valve involvement and the person is height is more. There are other abnormalities like high arch palate and aortic valve regurgitation, and the aorta gets dissected. Dissection means the blood starts flowing within the vessel, forming a separate path, and this is a very fatal condition. Sometimes the aorta gets dilated in a localized way, which we call as ballooning or aneurysm of the aorta. This could be of various shapes. I am talking about these conditions because surgically it is possible these days to replace the aorta, replace the disease segment, replace the aorta and the diseased valve in one operation, which is called Bental's procedure. So these are the advancement in the treatment of the heart disease which previously were not there. So we can replace, we can put a graft, we can replace valves, we can even replace valve from outside without opening the heart. So these are the briefly common man must know these advancements we have done in the research of the heart disease and valve disease and aorta and vessels. So there is a huge intervention which the cardiologists can do these days without sending their patients to surgeon, or vascular surgeons can do without sending their patients for an open heart surgery. So this is a very exciting topic. Now coming to the heart attacks. Heart attacks are very, very dangerous. As the word says, heart attack. The heart stops getting a blood supply in one of the vessels or two vessels. Usually it is one vessel at a time. But heart has got major two vessels, right and left coronary artery, and the right coronary artery has straighter course and less branches. Left coronary artery divides into significant two important branches, left anterior descending, left circumflex. Before that it's called left main. In India, I see commonly when I see the angiograms, there is a disease in the left vein or left circumflex. This is a pattern which we have been seeing because we don't know. One of the theories of the heart disease or coronary artery disease is that is related to frequent infections. The basic crux of the disease lies in damage of the inner lining of the membrane or inner lining of the coronary arteries. Basically two insults, either infection or high cholesterol. Mainly we talk about cholesterol when we talk about heart attacks. There is atheroma, that's why this disease is called atherosclerosis. And this plaque which forms within the pipe, that is the coronary artery, can sometimes rupture, it can get implanted into the distal segment of the heart, it can bleed, the atheroma can swell, causing acute obstruction, platelet can deposit, acute heart attack takes place. And this can harm in many ways because coronary obstruction does not develop overnight. It keeps developing slowly, and one day either this plaque ruptures or this gets bigger, or sometimes without a plaque one can have a heart attack. How? The coronary artery goes into a spasm. This sometimes is more commonly seen in ladies and most very commonly seen in those who smoke. Their arteries get thinned, their arteries get more sensitive to the nicotine. And I'm talking about smoking because smoking is the major prevention in the stoppage of the heart attacks. Smoking, obesity, high blood pressure, high uric acid, family history, diabetes. These are the things which make a person vulnerable to heart attack. Out of which, if you think one by one, we can prevent smoking, we can reduce weight, we can control the blood pressure, we can control the uric acid, we can control the cholesterol. Then what's the scope of most significant deterring disease? So this talk is basically to emphasize that heart disease can be prevented. So more focus should be done on prevention. Nowadays everybody knows how the heart attack takes place. Everybody knows heart attack causes death. Everybody knows smoking causes heart attack. Tobacco causes heart attack. Everybody knows stress also causes to some extent heart disease. Another thing which I am seeing these days is sleep deprivation. So these are all the things I am mentioning again and again because they are all preventive factors or things which is grossly called lifestyle modification, primary prevention or secondary prevention, which can make us live healthy and escape death from a sudden heart attack. You see, no one would disagree that obesity is a danger. I get obese patients. Everybody knows patient is obese. They also know they overeat. But when you talk about diet, you talk about exercise, they say, sir, I will start doing it very soon. No, that next day or from tomorrow never comes. We have to start it right now. Heart attack sometimes does not give us enough time to go to the hospital. But if it is diagnosed on time, then we can do sudden intervention, immediate intervention, and we can open the blocked artery by a procedure called ballooning, or which is called angioplasty, and we can put these stents. Sometimes technically it is not feasible to put a stents if the lesions are multiple or they belong to some specially nominated arteries, then we have to do surgery. These days, lot of money is wasted for surgery and stenting. I'm coming again to the preventive side because everybody knows bypass surgery, everybody knows stent. So much talk these days recently because the government has reduced the cost of stent, so on. So what is important for a person who is seeing this video, naturally who is not a doctor or is a patient, is that how can we prevent the heart disease? First of all, very simple is regulate your sleep. Have a healthy sleep habit. There is entire discussion on sleep hygiene these days. How should we sleep? How should the bedroom not have television, musical instruments, phones? Do not keep phones near you. And there should be very serene atmosphere in the bedroom, comfortable bed, and your partner. Everything should be in order. And the time of sleep should be very much regulated. Minimum 8 hours sleep on an average an adult needs, which we hardly have. Again, I'll come to the sleep deprivation. Most of us, especially young generation today, are sleep deprived. So we are harboring a fatal thing in the body by not sleeping well. So sleep is more important. Second is de-stress yourself. De-stress yourself by anything which you like. You see, I cannot say a general formula for everyone to de-stress. De-stress first means do not take stress for the things which you cannot do. Relax. When I say relax, I would say yoga, I would say adequate sleep, I would say balanced diet, which I am coming next. I would say exercise, I would say swimming, I would say golf, I would say playing cricket, whatever you like, listening music, because one can relax in many ways. So to choose the way you like, how you relax, or just do meditation if you don't choose any of these things. Sleep well, relax. These are the two sheet anchors in the prevention of the heart disease. Next comes the technical aspect of it. The technical aspect is first, blood pressure. Control your blood pressure. Every year on 17th May we have World Hypertension Day. How many of us celebrate? How many of us know? The World Hypertension Day for last 2 years and so on is saying know your numbers. At least I must know what my blood pressure is. Today I was overworked. I saw my blood pressure. It was 136/76. Usually my blood pressure remains like 110/106 by 70. So I knew today my blood pressure is high. So I have to take remedial measures. Either I have to sleep more, or I have to take medicine, or I have to go to the doctor, whatever. Or I have to regulate my diet tonight, sodium tonight, and things on. So first is sleep, second is de-stress yourself, third is control your blood pressure, fourth is control diabetes if you have. Diabetes control is again a big topic. We will discuss in the next time video. Diabetes control is most important because glucose, as it is good for our nutrition, if it is more in the blood, it causes toxicity. And we have coined recently a word, glucotoxicity. Glucotoxicity makes the cell age faster, especially I was talking about endothelial lining. Glucose toxicity damages kidney, damages heart vessels, heart muscles, microvessels, brain substance. From the hair at the head till the tip of the toe, it damages everything. So control your blood pressure, control your blood sugar. These are the two technical guidelines. And if you have high uric acid, control uric acid. Now, most important enemy of the heart is smoking. Smoking is such a hazardous condition that when we talk in literature, dil phat jata hai ya ruptured heart, it actually happens in case of smokers. When they have a heart attack, sometimes heart ruptures. It is so grotesque, so severe, it involves the whole thickness of the heart. So smoking does more damage to the heart than the clotting of the blood or cholesterol or diabetes. We don't realize it. These days, pattern of smoking is changing. Our children start smoking at a very early age when they are still in the school. Girls do smoke. So previously ladies were not smoking that much. Now almost 2/3, 1/3 is the ratio. Then smoking becomes such a habit that it is very difficult to de-addict yourself from tobacco which you smoke. And it goes on increasing. And we never know when the smoking is causing a heart attack. Smokers have very, very virulent heart attacks. And the good side of the story is, if one leaves smoking, the risk of the heart attack within 6 months falls to 1/10. So this is the beauty of stopping the smoking, and that's the hazard of smoking. And especially I am cautioning with this video to the younger generation, they should immediately stop smoking, otherwise they're going to have a very, very quick death, or death comes early. So smoking is as big as enemy as diabetes, hypertension and cholesterol combined together. Then another factor which is to be considered in this preventive aspect, that adequate exercise. Exercise increases the endurance. Very commonly when you go to gym, your gym instructor says do cardio. What does he mean cardio? Cardio means the exercise which strengthens your heart muscle. What basically happens? I'll simplify it very nicely, that if my resting, I'm sitting here talking to you, my heartbeat is 70. When I go to the treadmill or when I do a cardio exercise, it will go to 140 without telling me. I would not be aware of it. And if my heart has gone from 70 to 126 or 136 or 140 or sometimes more, then it's like the meter of the car. You normally drive at 40 or 60, but in good cars these days you see meters up to 200. You never drive up to 200, but that's a reserve. That's a reserve. So while doing cardio exercise, we achieve the cardiac reserve. It's very simple to understand. And we are prepared for the war when we are resting in the peace. That's how the word comes, war footing. Army does exercise every day. If they don't do exercise, they cannot fight the war. So if we do not do exercise, our heart cannot remain healthy. So that's the mainstay of exercise. Then people ask how much exercise a day, 25 to 30 minutes, 5 days a week. If you do regularly, that's beautiful. What exercise? I would say whatever suits you. It starts from walking, running, cycling, swimming, gymming, any exercise. Whatever sports you like has a component of exercise. So do exercise. Do not do philosophy. Some people buy treadmills. 95% treadmills lie at home without being used. So we should actively do exercise. Then when I talk of exercise, I've already told in the beginning of the video that we should also do yoga, we should also do pranayam, we should do deep breathing. At the same time, our lungs should be healthier, as we want our heart to be healthy. So when we do cardio exercise, it does make our lungs also strong. It increases our skin circulation. It makes ladies beautiful, everyone beautiful, flushing, gushing, active, and brain also. Those children who do exercise, they are intelligent, they compete better than those who do not do exercise, they become lazy. Then also prevent the endocrine disorders which you have, like you have adrenal disorder or hypertension due to adrenal disorder, hypothyroid. So all these things, they are the fineries of the heart disease. We should prevent heart disease. We should talk of prevention of the heart disease, because this is a condition on which millions of dollars are wasted to treat. It causes a lot of burden on the exchequer of each country, because in each country heart disease is getting commoner, and it's becoming leading cause of death after the accidents. And therefore we have to prevent heart disease, we have to prevent hypertension, we have to prevent diabetes. These three things, especially in India, I'm talking together, because in India we are going to head becoming the capital of diabetes. I don't think we have already become, but we are very soon going to become. By 2050, it is said, usually we are going to become capital of diabetes. Similarly, we are going to become capital of heart disease also. We have already topped in pollution. So pollution is also indirectly related to the health, especially the health of the lungs. Also especially health of the tissues. When we were talking about the endothelial lining, it's related to the endothelial dysfunction. And when I say pollution is related to endothelial dysfunction, I mean every organ should get affected by it. I see newborn children breathing the same polluted air as we are breathing. I feel very sad, very pity about them. What crime they have done to breathe this filthy air. Most polluted countries, 4 top most polluted countries of the world are in India, and that's way we have progressed. I feel sorry to say this, but this is a fact. Then drinking water is also important. Drinking water, people think that RO water is very good for health, which it is not. Boiled water is better than RO water. Why I am talking of water is that many times when we drink less water, or we drink water which is not good, so body gets dehydrated, and then we get more chances of blood getting thicker, and therefore more prone to the heart attacks. Similarly, much talk is being done these days, I'm not naming any brands, about the refined oils. We were very excited 10 years back about refined oils, but if you try to learn the procedure how refined oil is made, you would hate refined oil. So our old system, old Indian system of having karwa tel or mustard oil or til oil, or if we can afford olive oil, combined with deshi ghee, now we talk of gai ka ghee, desi ghee, is best. Come back to that. You would have a healthy life. And there is no controversy when I say ghee and natural oils like mustard oil, til oil and olive oil are better than the refined oil. There is no controversy. This is also healthy. Then other thing which is causing problems, medical people never talk about it, is food adulteration and water pollution. Due to the water pollution and food adulteration, a lot of bad things are going in our body. You see anything, starting from microwave in the kitchen, RO in the kitchen, non-stick pans, aluminium in the kitchen, everything is unhealthy. And we have switched to this very gradually. When we were growing, we were children, We used to have copper utensils, and we used to have them clay with the zinc, which was healthy. Then it changed to stainless steel, which is far better than aluminum and this Teflon. Then gradually poor people have adapted aluminum. And why poor? Rich people are also wrapping things in aluminum foils. 10% of it leaks to your food. Then non-stick cookware. So everything, as we are making progress, to somehow leading us to backwardness of the science. At one end we are progressing, at other end we are losing health due to advancement. I can say it like more a better way. So we should be health conscious. We should be having a routine in life. We should be sleeping adequately. We should do exercise, whatever type. I have said yoga, pranayam, gymming, exercise, swimming, cycling, so on. And we should control our diabetes, control the blood pressure. And most importantly, stop smoking, stop smoking, stop smoking. I'm stopping my talk by saying 3 times. Smoking is the biggest enemy for the heart and lungs. Not only it does only cause cancers, it causes heart attacks. And these all things which I have talked in this video, if you hear it again and again, I have never talked something like treat this way, treat that way, which is the doctor's job. But I am telling you the ways how not to reach a doctor, how to stay healthy. And these are the things which is in your hands, not in my hand and doctor's hand. And you can win over all these enemies. You can win over all these obstacles which are day to day there. And that is how you can have a healthy heart, healthy blood pressure, and healthy blood sugar. Thank you for your time for watching this video. But if you can get the message deciphered, is stop smoking, control your blood pressure, control your diet, cholesterol, have a healthy eating, do exercise regularly in whatever form you like, yoga, meditation, gymming, swimming, anything, cycling, and control your blood sugar and blood pressure. These all things are in your hand. So a healthy heart is also in your hand. So I now say goodbye to you with these golden points, that if you practice this, you would not need me. You would have a healthy heart. Thank you very much.